Hi everybody. Next DNV question is hepatic iron quantification. Before knowing the hepatic iron quantification by MRI, we should know the iron metabolism. Normally, if you take oral intake of 10 to 20 milligrams per day of iron, 1 to 2 milligrams is absorbed in the proximal duodenum. From there, it goes into the blood. Plasma iron is transferred by transferrin. It is an iron transport protein. Normally, this normal transferrin saturation, how much of iron is binding to transferring is 25 to 40%. If the iron levels are more, this saturation becomes this transferrin saturation will be more than 45% in iron overload. If the transferrin saturation is more than 45% in iron overload, then non-transferrin bound iron will be present in the plasma. This non-transferrin bound iron which is present in the plasma has high affinity for hepatocytes. So they go and store in the hepatocytes. If the transferrin saturation is more than 75%, that is these two, more than 45%, more than 70%, both in iron overload, remember normal transferrin saturation is 25 to 40%. Here if it is more than 45%, what will happen? More than 75%, what will happen? If it's more than 75%, in the blood we have free labile toxic iron radicals. They get attracted to the hepatocytes. In the hepatocytes they cause oxidative stress on the cells, inflammation and fibrosis. This one you remember. Then iron is stored as ferritin. Suppose if the iron is so much, this ferritin is also get saturated, then it is stored as hemosiderin. In iron overload conditions, there will be high plasma iron accumulation in the parenchymal cells in the form of ferritin and hemosiderin. Liver is the organ where the iron is stored. It's in the hepatocytes and Kupffer cells. So normally when you image this liver, it is a mirror for iron homeostasis in the body, because it is the most important organ for iron storage. Coming to causes, hepatic iron overload causes primary and secondary. Primary hereditary hemochromatosis, secondary hemosiderosis, iron overload disorders. Remember, there are certain conditions where they also have elevated serum ferritin and hepatic iron. They are viral hepatitis, alcohol-related cirrhosis, metabolic syndrome, diabetes mellitus, non-alcoholic fatty liver disease. In these conditions also there will be elevated ferritin and hepatic iron. This one if you remember, then we can go into the hepatic iron quantification. Thank you.